And thanks for staying with Morning Live. Now, the Special Investigating Unit, or the SIU, is reportedly probing at least 6 companies that are accused of supplying non-compliant COVID-19 personal protective equipment. And this is according to the South African Health Products Regulatory Authority, or SAHPRA. And this follows recent findings of a study which reveals that some of the KN95 masks that have been distributed to healthcare workers were actually not effective. And joining us now to talk more about this, as well as some of the regulations around COVID-19 vaccines, is Momeena Omarjee, who is the Acting Manager for Medical Devices at SAHPRA. Momeena, thanks for your time. Welcome to Morning Live.
Thank you, Sakina, and thank you for having SAHPRA on today.
Perhaps a good place to start is to just explain exactly what your mandate is as the South African Health Products Regulatory Authority.
So the remit of SAHPRA, or as you said, the regulatory authority, is to ensure and maintain the safety, quality and performance of medical devices, or the efficacy of medicines. And we work within the remit of the Medicines Act, but our primary role is to protect the public and its public health issues, but definitely the safety, quality and efficacy of all medicines and medical devices that will go into the South African market.
Now, Momeena, just coming to the case at hand. Now, there was a study by Professor Keaton Deda, who is the director of the Center for Lung Infection and Immunity. And it was published in a journal, and the article basically saying that the medical mask, those are the KN95 filtering respirators distributed in South Africa, actually failed the safety testing protocols. So if we can just, explain in simpler detail, what does this actually mean for medical practitioners who are, of course, on the front line and anyway prone to getting infected with COVID-19? Please explain to us the KN95 mask, and there's also the N95 mask. All very technical, but for ordinary folk like us, please simplify it. Why these KN95 masks distributed in South Africa are problematic?
Okay, so let me start off by saying the certifications on these particular masks, so your KN95, your N95, your FFP2, are certifications that are given by different originating countries. So in South Africa, when we manufacture, we generally manufacture to a particular standard, which is your FFP2. And all that means it's the filtering face mask. So it's a respirator mask. But the difference in the names is just a certification coming from different countries that's looking at the filtration efficiency of a particular mask. The problems that South Africa has had with the KN95 mask, or the substandard quality of the masks, or sometimes the falsified masks as well, has prompted SAHPRA to amend, and quite early on during the COVID pandemic, was to amend our regulatory pathway and our licensing pathways for particularly masks and PPE as well. So what we have done is we've put in more stringent requirements and more stringent conditions when these masks can be brought into the country and can be manufactured into the country. But in terms of KN95, it's being imported into the country and then distributed. With the substandard quality of these masks, there's obviously a higher risk of contagion, not only to the healthcare professional, but also to the public and the users that are within the hospital settings as well. So we've put in these additional measures to ensure that these KN95 masks that are coming into the country have more conditions put on them, have more restrictions put on them, and the importers that are bringing them into the country as well have more restrictions on them.
Now, Momeena, the SIU is currently investigating unlicensed PPE manufacturers and also some of the PPE products. But how do you tell what's the real deal and what is not? Because if we recall, it was said that the masks that we wear need to have 3 layers, but we have these blue masks that all of us buy and wear. They are the cloth masks. How do we tell what is effective and what is not?
I'm just going to go a little bit back, Sakina. So the mandate of SAHPRA is for medical or surgical masks, as you said, the blue masks with the 3-ply layers. And then you have these KN95 masks, which are respirators. And these products particularly fall under SAHPRA's remit when they are intended for use within a healthcare environment or a high-risk setting, and also when one is making a medical claim or some sort of therapeutic claim that it protects against viruses. When one looks at the cloth masks or even some of the blue masks, the 3-ply masks that are used by the general public, SABC's remit doesn't extend to that. But what the Department of Health has done, they have put out a guideline on how to use these fabric masks, when to use them, and also I think they've put out guidelines on how to actually make these masks. But for SABC's remit, we look particularly at the masks that are to be used in the medical environment. And if one is looking for if a mask is compliant or not, or if it's substandard or if it's falsified, there's particular markings. So one should look for, on a KN95 or an N95 mask, for example, one should look for the manufacturer's stamp on it, that there is a manufacturer's stamp on it. One needs to look for, do they have the filtration efficiency, which is either N95 or KN95? Do they have the compliance standard that the particular product needs to be compliant to? And if it's coming from, if it's a global product, then it will have a global standard on it. If it's a South African product, it will have the South African national standard on it, as well as manufacturing dates, expiry dates, and sometimes when required in terms of the NRCS or the SABC, there will be a stamp on the product as well. So there are some deciding factors that one can use to see whether a product is substandard or standard, but a really good denominator of whether a KN95 mask is substandard is the face fit of that particular mask, which is really important when one is using it in a healthcare professional setting. So before one uses it, ensure that the mask you are using fits your face perfectly to avoid the leakage, and the filtration efficiency can be as intended by the actual manufacturer of that particular product.
And in closing, Momeena, a lot of talk about vaccines at the moment. As SABC, how will you regulate vaccines coming into the country? You know, what requirements do they need to meet? Once again, sorry to repeat it, but then the mandate of SABC is the safety, efficacy, and quality of medicines, and vaccines are included within that. So when one reviews a particular medicine or a vaccine, in this case, we will review it for the quality, safety, and efficacy. And due to the urgency of the products and the vaccines, it will be expedited reviews, but it will not impact on the quality of the product. So it will be an expedited review that will not impact on the quality of the product that's going to be put out onto the South African market. But it will follow very much the same route that we follow for any other medicines, which is a proper review of quality, safety, efficacy. And in this case, we will also base it on reliance and recognition mechanisms of the other stringent or mature regulatory authorities, the FDA, the EU, and other authorities as well. Well, Momeena, we have to leave it there. Thank you so much, Momeena Omarjee, Acting Manager for Medical Devices at SABC, talking to us about the SIU probing 6 charges against companies who've been supplying non-compliant masks. And this after a study found that some of the KN95 masks that's distributed to healthcare workers were actually not effective. And also looking at some of the regulations around COVID-19 vaccines and the role that SABC